So why do you struggle in a close? Why does a typical average marketer, average liaison, struggles in closing the deal? Well, number one, they don't have commitment to greatness. They just want to earn their living, but they're not asking themselves to, do something great or be above everybody else. What I want to be able to teach to people is I want people to understand that they need to be able to come into the office and know that they need to be able to be successful, that they need to get every single referrals away from the other people in the industry. That your company should be the company that these physicians are referring to, that these hospitals are referring to, that these nursing homes are referring to. Number two, they don't have enough closing materials. They have a shortage of it. They don't even have. I've even talked to a few marketers out there who are new in the field or who've been around in the field, and they don't even understand why they're not getting referrals. Well, when I asked them, I said, well, what are you using for as your closing materials? They'll say, well, I have a business card, I have a brochure. No, that shouldn't be the only thing that you should have for your materials and closing. I'm not just talking about, brochures, business cards, or presentation folders. Do you have an arsenal, an arsenal of words, of scripts on how to be able to present? You can't just go into a presentation and think that you can just wing it, that you're just going to say the first thing that comes in your head. No, you should have ready-made scripts that you already memorized, that you can custom, that you can stack on top of each other. And that's what this part is here, is on the closing parts and how to be able to stack closing scripts. Now, the presentation part, we have a whole separate section of training on how to be able to have that really solidified presentation. And at the same time, as we also have a separate presentation for you guys on how to be able to cold call people. And I truly suggest that we're going to work on the close right now, and I'm glad to hear this part, but I truly suggest you are able to take advantage of our cold calling presentation, our presentation workshop, where we can actually help you guys create wonderful presentations for your organizations. All right, number three is believe the price is the issue. Okay, so this part right here we're talking about for non-medical. A lot of companies out there, a lot of owners for home care companies, non-medical and private duty, they have this belief that they should be the lowest price. Okay, or they'll say that their price is too high. If you work for the company, your price is too high. That's why you're not getting the referrals. That's a complete myth. Okay, there can only be one home health or home care company out there that charges the lowest. Nobody can be the lowest. Not everybody can. Only one can be the lowest. But the biggest problem being the lowest is that you don't have any margins. And at the same time as that can cause problems and be able to create income for your organization. So price is never the issue. Some of the things that we teach people is that if you're charging high rate, let's say for example the average in your area is $22 an hour and you're charging 25, what makes you have the right to charge 25? What other services do you offer that maybe the others are not providing? So look, price is not always the issue. If that's the case, why are people purchasing Louis Vuitton bags? No, because they have a belief in the product. And that's what you need to be able to create, the urgency, the belief in the product, and transfer that to the client, to their family member, to those referral sources. Number four, they buy the customer story. All right. And when we talk about customers, what we're going to talk about is we're going to talk about your potential referral sources, the patient itself, the family member that's trying to get a home caregiver for their mom or their dad. Okay. So if you believe the physician that they're not referring any patients, all right, and then you actually did your due diligence and you know that they have geriatric patients that they can refer to you, well, you believing him that they don't have any patients, that's you believing in the customer story. If you believe them that they say something like they're already referring patients to other agencies, right? Then you're believing that and you're going to be moving on. Well, that's you believing their story. Look, of course they have referrals. Of course they're giving it to another agency. I'll believe that, but that does not take away from me creating my commitment for myself, going back to the number one, committing to greatness, meaning that just because they're referring to another agency, I'm greater and better than their agency, so I know you're going to refer to me. All right? Number five, unwilling to pressure. Look, we're in sales. we're marketing our company. We're going to be pressuring people to start using our services. And if you're not willing enough to put a little bit of pressure on someone, well, guess what? You're not going to get those referrals. And we need to be able to bring ourselves. So, what's pressuring? Well, if we're following up people left and right, if you actually have a correct follow up process, you are tending giving them some pressure to start referring to you, or else you're going to keep on following up with them. So, people who are unwilling to pressure people, those are one of the biggest reasons why you don't want to get a close. You don't want to get that, you don't want to ask for that referral. People feel sometimes that I don't want to be pushy, right? I don't want to be pushy. I'm going to wait till I get to the office and I'm going to give them a call and ask for that referral. I'm going to call them a month later and I know they're going to give me a referral. No. We want to be able to teach you guys that the moment you're doing your presentation, right, you need to learn how to be able to ask for that referral continuously. All right? There's that one line that I love the most in sales. Is called always be closing. The ABCs of selling is always be closing. And it also applies in the part of trying to market our home health, our home care, and our hospice company. You should always be closing. Number 6, lack the financial goals. What are we talking about here? Well, as an organization, let's say, what's your goals on how much your company wants to make at the end of the year? Do you actually have a plan? Do you already know what what you want? If your company wants to make $1 million, well, how are you going to make that $1 million? You need to be able to divide that in 12 months and figure out how many patients you need, how many new referrals, how many hours you guys servicing, how many new referral sources. You need to be able to figure out first your goal. What's your financial goal in the end? And to be able to achieve that. If you're a marketer, let's say, for example, you are set up to actually have a commission-based, you have your baseline, you have your baseline pay, yet you have incentives. How much you want to make at the end of the year. Well, if that's the case, what are your financial goals? If your goal is to make $60,000 a year, okay, then how much is that do you have to make each month to be able to reach that $60,000 a year? Okay, so you need to make $5,000 a month. Okay, great. If I need to make $5,000 a month, how much is it going to take me? How many referrals? How many potential referral sources do I need to bring in? Okay, these are the things you need to be able to have. You need to have your goals, your whys. Why do you want to do this? So you need to first of all, exactly have your financial goals. Number 7, people are not closing because they don't have the training. And that's what this training right here is for, is to give you guys the basics and eventually work on getting you guys the advanced training, the advanced closes. Okay, first we need to be able to help you guys walk, then we're going to help you guys run and then jump. Okay, so no training. I'm glad that you're attending this program because this program is providing you guys the training. And when you're getting your training, it shouldn't be just one time. You need these presentations to be able to continuously watch this presentation that we're offering you guys. Okay, so we want you guys to consistently train yourselves, train your team, train your owners, train your administrators. Everyone should be trained in the power of closing, because closing is not just meant, okay, it's not just meant to actually get those referrals, to get those patients. We actually teach these closing techniques to even our nurses. Because how many times have you actually lost patients because all of a sudden the patient just didn't want any more services? Your nurses should be trained at closing the deal. Your people in the office should be trained in closing the deals. And that's the goal here, is to train everybody in the facility, in the organization, to be salespeople, to be closers. Okay? Only the best of the best, only the most successful companies out there are successful because they have closers working for them. Number 8, lastly, they're not sold. They're not sold in the industry. Maybe they shouldn't be in this industry no more, or they're not sold in the product, or they're just not sold at all. They just don't believe that home health works. And if you are not sold on yourself, on the product, well, guess what? It's going to transfer and you're not going to be able to sell your services at all. You need to understand that if you don't prepare, why would you think that you're going to win? Does, the NBA basketball teams, do they just not practice. They just figure that, we're great. We get paid millions of dollars. We're going to win. We don't need to practice. No, they practice, right? All the major football teams, baseball teams, basketball teams, soccer, whatever sports are out there, for them to become great at what they do, for them to be able to have the commitment of greatness, they have to be able to continuously train themselves to become great. All right? And that's the biggest thing, is that we also, in our home health industry, the home care, the hospice industry, we train our clinicians left and right. We train our billers, okay? Yet the problem is, we don't even train our marketers and our liaisons. When the only reason why our business is running is because what? We're bringing in patients. The only way a company can win and become successful is if they actually bring in referrals. Yet we are not training everybody in the marketing team and the liaison team, the administrators, on how to be able to get referral sources. They just think that you have a license and some insurance and then you can go out there and get patients. Doesn't work that way. So we need to be able to practice. We need to be able to, drill ourselves, and we need to be able to be rehearsing ourselves, okay?